Hello everyone, this is Nerdy Neuron and today we're going to talk about the most important hemoglobinopathy, sickle cell anemia. Alright, so this is 10 to 20% common in African Americans and Hispanics. So this Hispanics are those who speak Spanish language. The second point is this disease is autosomal recessive. Okay, so it does have the sickle cell trait or the sickle cell disease, heterozygous form and homozygous form. So this is a kind of genetic blood disorder. So assume if the father has HbAs and mother has hemoglobin. Yes, means they both have this abnormal gene in their hemoglobin. Then so this we call sickle cell trait, and now the baby born with the sickle cell disease, and this chance is 25%. So this baby has 25% chance to have this sickle cell disease. Now, so what is the pathology behind developing this disease is point mutation. So point mutation, it is the single base pair point mutation in beta globulin gene because of substitution of valine for glutamic acid at position of 6th, where beta chain of HbA, adult hemoglobin. Okay, so this is most important point. Now what will be the mechanism of sickling, like how this sickling appears, like the normal RBC converted into the abnormal one. So mechanism of sickling. Look, this is the normal RBC. Okay, the red color will be more suitable for this. So this is normal RBC with the, so this is the oxyhemoglobin, normal RBC. When there is low oxygen tension or low oxygen, then what will happen? This RBC have the hemoglobin which will become less soluble hemoglobin, and this will precipitate into crystals within the RBC, like that, like this. So these all are the crystals. Now what this crystal will does? They will elongate and give them shape of sickle shaped. These crystals will elongate like that. Now the biconcave shape will be converted into a sickle shape. In Hindi we call it hasiya. Sickle is hasiya. Okay, so it is looking like hasiya here. So there is change in shape. Now what will happen because of this sickling? So sickling, what it will does? So HbS, which is the abnormal hemoglobin, it is less flexible and it will block the, yes, it will block the micro circulation. Now the sickle shaped cell, they are no more normal RBC, now they are sickle shaped cell. They will increase the blood viscosity. They have tendency to stick with each other, they become more sticky, they block the circulation, they become less flexible, and ultimately there is decrease in blood flow to the various tissues of the body, and they become more what? They will more fragile, which leads to hemolysis. So this sickle cell anemia, if we will classify it under the Witt-Bice classification, it will come under the hemolytic anemia, which is normocytic and normochromic, is normal shape and normal color. Okay. So the sickle cell trait is inherited as a Mendelian dominant, but the full blown disease is autosomal recessive, which occurs in a homozygous. Now what will be the sign and symptoms? Obviously the first and important is anemia, which will be the hemolytic anemia. The second is pain, and this pain is periodic in episodes. And why this pain is there? Due to the blockade of tiny blood vessels, and there is swelling of feet, hand and feet. The third is infection. Yes, the infection rate will increases. The fourth will be the delayed growth and development. There must be a visual and heart problems. So there is one more term is sickle cell crisis. So what is sickle cell crisis? It is crisis. So actually in sickle cell crisis, it more prone to happens when the probability is more when there is sickle. It's a mnemonic. Means when there is significant blood loss during surgery or trauma, when there is chronic illness. C, when there is climbing or flying to high altitude. And K is for keeping continued stress. L, low fluid intake, means dehydration is there. And E is elevated temperature. So all are the predisposing condition for the sickle cell crisis. And in sickle cell crisis, when there is low oxygen tension, then the RBC become more stiff, viscous, and then because of this they occlude there will be occlusion of capillaries, which will cause the ischemic pain due to microinfarct, and there is malfunction of ischemic organs like spleen, kidney, as well as because of stickiness of these RBCs, the lifespan of RBC will be shortened and there will be hemolysis, and which will cause the anemia, jaundice, as well as gallstones and also leg ulcers. So, there are a lot of things with this sickle cell crisis. So, there are some routine newborn blood testing is there, like dithionite test is there, and hemoglobin electrophoresis for the routine newborn testing. Now, what will be treatment? How will treat it? So, yes, we will avoid the predisposing factors, like so maintain the hydration of the patient. Hydration. Obviously, there are some meds like 5-azacitidine, as well as the hydroxyurea. Okay. So, what these two drug does? They help to decrease the polymerization of HBS, which is deoxygenated, and they will help in formation of more HbF. So, this is their mechanism of action. The second is blood BT. Yes, blood transfusion is also helpful. Third is bone marrow transplantation. So, these three things will help in some cases. Okay, thank you.